Good afternoon, everyone. Win Brown here on Friday, October 29th. You can tell the sun is just about to set, and so hopefully not too much sun in my eyes as I give you an update for Heywood for today, for the week that we've just had. Hope everybody's ready for Halloween and has their candy ready. It looks like Sunday is going to be a good day, and Saturday night, if you're trick-or-treating Saturday night, might be a little wet, but the kids will still get out there and enjoy it, I'm sure. I just want to give you first an update on our COVID-19 update. We have tested now over 111,000 specimens, a total of which about 5,600 are positive. Our cumulative testing rate sits firmly at 5%, almost twice the state at 2.75 over the course of the pandemic. Some positive movement on our 7-day average at 7.36%. But still incredibly high, what's considered in the red zone in the state, and versus the state rate at 1.67. So think about that. We have 10 positive COVID-19 patients at the hospital as I report to you tonight. Again, our trends are decreasing, but still in the red zone in the state. Our community average is 33.4 per 100,000, down 4.2 from last week. The state is 17.5 per 100,000, so again, twice. Westminster still is the highest in our region, and the lowest is Winchendon, and so Orange is actually slightly up over the past week. Just to remind people, given the level of COVID-19 prevalence in our community, we still have very strict visitation policies at the hospital. I know that this frustrates a lot of people. They want to be with their loved ones. A lot of people don't understand, thinking that, well, we go home to our families and we do a lot of other things. Why should the general public not be allowed to come into the hospital? And we really just need to limit our exposure. It's a huge burden to care for not only our typical patients that are not in for COVID-19, but the 10 we have in as well. And it's a heavy load for our staff. And to also manage family members and visitors just makes it really difficult to do our job. And also, we can't have visitors with our COVID-19 patients anyway because they are carrying the disease, and we just need to limit our access. So please be patient. I know it is frustrating for family members, but equally frustrating and challenging is for particularly our nursing staff on the floors who are fielding a number of calls asking, being pushed why they cannot see their family members. It's just not fair to them. So please abide by our rules, understand why we're doing it. We have infection prevention specialists and experts in the field, and this is how we're operating right now. If we can continue to see a steady downward trend in our region and we leave the red zone and get to a more manageable level of the disease in our community, which would happen by people socially distancing, wearing their masks and getting vaccinated, and now getting your children vaccinated, that will put us in a position to be able to do that. And also just a shout out to staff. A lot of us have badge access to many parts of the hospital. Please do not abuse your privilege as someone at Heywood Healthcare using your badge to get into a unit to see a family member of loved ones. Not ethically the right thing to do, but also puts a burden on staff and creates a lot of tension. So please, we've seen a little bit of that and we're better than that. So please do not go where you are not necessarily supposed to be working. Just an announcement, it was a big day for us at Heywood. We returned our medical practices in the Heywood Medical Group to Athena medical record from Expanse, which we had transitioned to in February, and really felt that the Athena platform is much more robust for our providers, our staff, and also for our patients. So we have our command center up throughout the weekend. I think overall it has gone very well. There are a lot of testing and transition things that are still being worked out, and they're going to be worked out on 24/7 until we get Athena back up to where it used to be. So patience to our patients, please, as our staff transition to a new EMR for some of them. Some are returning to Athena, but some have never used it before. So when you go to the practices, please be patient with our staff as they try to serve you. And there's a new patient portal web site link here for you to link into the Athena portal so you can get your results directly from lab and radiology yourself. Just a reminder to our staff that our mandatory education, we moved the date out for mandatory education to November 11th, knowing we had a lot of things going on in our health system, so please get that done. And on November 15th for our staff across the health system, we will be launching our annual staff engagement survey. So please, our goal is to have over 70% staff participate in that. And as You know, there's been a lot of work done since the last survey to improve the working conditions and options and things that we can do to support our staff. So it's very important we hear from everyone. And then for those of you who might not be aware, but you also would have hopefully seen your email today, Dr. Helen Heenahan, our Chief Medical Officer and also primary care provider in Ashburnham Family Medicine, announced a couple of weeks ago that she'll be retiring at the end of the year. And we are very sad to lose her on our team. She is an incredible clinician, champion of quality, and just an amazing member of the senior team. I'd call her the dean of the senior team. And so we just want to wish her well as she prepares to leave us in the middle, probably right before Christmas. She's supposed to stay to the end of the year, but I think she's got some holiday plans, so she'll probably leave a little bit before Christmas. But also we announced today that Dr. Andrew Cocciarella, who, as all of you know, is the president of actually the Heywood Hospital medical staff, and also our medical director of perioperative services and anesthesia, is going to become our acting chief medical officer upon Dr. Heenahan's leaving our family. And we also want to thank Dr. Erin O'Hara, who is the vice president of the Heywood medical staff, for her willingness to step into Andrew's role as president of the medical staff early. As the chief medical officer, you cannot also serve as the president of the medical staff. So that is pending a medical executive committee vote next week, which I am very confident the medical staff will elect Erin O'Hara, who's one of our stellar primary care physicians, to step into his role. We also celebrated Joy Page, who has supported neurodiagnostic department for 35 years. There's a great picture of her here with Dr. Tannenbaum. She's up on the third floor, has been on the third floor as of late, working with Dr. Tannenbaum in our neurodiagnostics lab, right next to pulmonology and our wellness center. So appreciate her. She's always been just an incredibly strong member of our team, quietly goes about her business and is exceptional in patient care as well. And also, our medical staff, every year we celebrate our medical staff, their years of service. We have our Faust and Harrington Awards that we do. And last year, because of the pandemic, we were not able to do that. And so next week on November 3rd at 6:30 p.m. on Zoom, we have an awesome Zoom program planned. Packages will be arriving shortly at each member's active member medical staff's house. So they have something to celebrate as we do that together online. And I hope our physicians and advanced practice providers will come out in force to be together. We'll have breakout sessions at the end so that you can socialize and connect with your medical staff colleagues. And then we have some special presentations to do as well. This is also National Facilities Week, and you know we have an incredible facilities team, much more dynamic than a lot of hospitals because we have carpenters, plumbers, electricians on our staff. We don't outsource that nearly as much as a lot of places do, and we're very grateful for the work they do, including our boiler room plant, who makes sure that we have heat and electricity and hot water and air conditioning. So thank you for everything everyone does in our facility staff to keep Heywood and Athol and our outlying facilities operating. And also in recognition of Veterans Day in November, the Mass Department of Veterans Services and SAVE team will present Battle Mind training presented by Nicole Darden. So I hope you'll be able to join on that. And there's also a Massachusetts Suicide Prevention Task Force meeting via Zoom Monday, November 1 from 8:30 to 9:30 in the morning, and monthly the first Monday until April 2022. There'll be weekly updates on that in this video so that you can click on to that. I hope you have a great Halloween weekend and appreciate everything everyone does as we continue to be one of the best community-owned health systems in America. Thank you.